The nurse evaluates a patient's status post-right hip replacement and observes a moderate amount of serous drainage on the dressing 1 day after the surgery. Which of the following is the best action? A. Leave the dressing alone to let the wound heal. B. Notify the doctor about possible infection. C. Change the dressing and clean the site with normal saline. D. Replace the dressing and document. E. Remove the dressing and leave the wound open to air. The answer is D. Replace the dressing and document. 24 hours after surgery, surgical wounds are expected to drain small to moderate amounts of serous or serous drainage. The physician does not need to be notified because this observation is expected and not emergent. However, the doctor would be notified if drainage exceeds these expectations. The soiled dressing should be removed and replaced with a new dressing, and the wound site would not be irrigated unless infected. There are no signs of infection noted. The wound should not be open to air due to the risk of infection. The nurse should always document wound appearance and dressing changes. The nurse prepares discharge information for a 70-year-old woman recently diagnosed with osteoporosis. Which of the following information is most essential for the nurse to share with the patient? A. A recommendation for a doctor that specializes in bone pain. B. An information sheet for acetaminophen use. C. A pamphlet about physical activity and daily exercise for people with osteoporosis. D. A flyer for a soccer program. E. A brochure about opiate medication use. The answer is C. A pamphlet about physical activity and daily exercise for people with osteoporosis. Osteoporosis is common among elderly women. Patients require important education on how to live with the disease. Lifestyle changes such as diet and exercise should be promoted by the patient during discharge, and should be specific to the patient's condition. Of the available options, the most accurate and essential information for the nurse to share should concern physical activity and exercise, as osteoporosis affects bone density and body strength. A recommendation for a doctor that specializes in bone pain may be beneficial, but is not a responsibility of the nurse. Education is the priority. Patients with osteoporosis that are being discharged usually take ibuprofen to manage pain, not opioids or acetaminophen. A soccer program may not be appropriate for a 70-year-old woman with osteoporosis. A flyer for an adult walking group might be better. All of the following are common findings in osteoarthritis except A. Stiffness and pain in affected joints. B. Bony protuberances of affected joints. C. Symmetrical joint involvement. D. Asymmetrical joint involvement. The answer is C. Symmetrical joint involvement. Osteoarthritis generally presents as asymmetrical joint stiffness and pain, often with bony protuberances, osteophytes, that are either palpable or visible on imaging. Symmetrical joint involvement is more typical in rheumatoid arthritis. Joints will present with signs of inflammation, redness, heat, pain, and swelling, due to the inflammatory nature of this condition. A positive anterior drawer test of the knee would be indicative of injury to which of the following structures? A. Lateral collateral ligament. B. Posterior cruciate ligament. C. Medial collateral ligament. D. Anterior cruciate ligament. The answer is D. Anterior cruciate ligament. The anterior drawer test of the knee checks for injury to or instability of the anterior cruciate ligament. During this test the patient lies supine position with knees bent to 90 degrees. The practitioner sits on the both feet of the subject and places both hands around the upper tibia of the patient's symptomatic leg, then pulls anteriorly on the proximal tibia. A positive finding would be excessive anterior translocation or a softened feel, indicating a sprain or tear of the anterior cruciate ligament. Lambert-Eaton syndrome is associated with what malignancy? A. Gastric carcinoma. B. Colon cancer. C. Small cell lung cancer. D. Melanoma. The answer is C. Small cell lung cancer. Approximately 60% of individuals with Lambert-Eaton syndrome have small cell lung cancer. The onset of Lambert-Eaton symptoms often precedes the detection of the cancer and should be followed up with radiographic imaging of the chest.